Hi, my name is Nicola Freeman and I'm the team leader for the Guildford and Waverley Social Prescribing Service. Today I'd like to tell you a bit more about who the service is for and how it works. A lot of people ask what social prescribing is. Certainly there are several models available throughout the country, but the model that we follow in Guildford and Waverley is one that helps people who have non-medical, often social issues that are affecting their health and well-being. We do this by linking people into local services and organisations in their community. As a team, we are attached to the 4 PCNs in Guildford and Waverley, but are based in the voluntary sector at Voluntary Action South West Surrey in Guildford. We take referrals from health and social care professionals and the 2 borough councils. We're hoping to open up referrals to individuals and community organisations in the future. Why might social prescribing be important? Social prescribing is designed to address some of the determinants of health. It's widely recognised that health is affected by a range of social, economic and environmental factors, and social prescribing addresses these by finding services and organisations to support people with a wide range of social, emotional and practical needs. It's been shown that the health of vulnerable and marginalised groups is often better addressed by community-based approaches than more traditional ones. By being based in the voluntary sector, our social prescribing service is very well placed to identify community-based services and connect people with them, and in doing so, go some way to addressing some health inequalities. Finally, by addressing the wider determinants of health, social prescribing is able to prevent people shifting into worse health, which inevitably places a greater burden on health and social care. So who does social prescribing actually help? Well, our service is open to anyone who's over 18 and is able and willing to engage with the service and is registered with a GP in Guildford or Waverley. Some of the issues that a person might have that would benefit from a referral to social prescribing are when a person's social needs are not being met, and this is affecting their mood and ability to cope. And in that case, you might see people who are suffering with loneliness, social isolation, life changes, financial issues, anxiety, possibly substance misuse or mental health issues. COVID-related issues are definitely present at the moment. And some of the things we help people with in this time of lockdown are shopping, prescription delivery, transport to appointments, food bank referrals, and also addressing loneliness and social isolation and anxiety about COVID. We also help people with non-medical options for physical health. So we might refer people to gym membership, weight loss groups, walking groups, or smoking cessation. We also help people who have long-term conditions which affect their social and psychological well-being. We have had people come to the service with multiple sclerosis, strokes, mental health issues, substance misuse, hearing and sight loss, and things like COPD. We also support carers. We can link them into support groups. We can help them navigate the healthcare system. We can help them find respite options and also put them in touch with GPs to access the GP Carers Break Fund. And finally, another group that we help are people who are frail and may need a home assessment, may need help accessing equipment, transport, care providers, exercise classes, benefit entitlements, care needs assessments, and also those same issues of social isolation and anxiety. So we would be looking at all those groups of people and seeing how we might be able to link them in with organisations in their community. So what does your social prescribing service look like? In the team, we have 1 team leader and 5 social prescribing link workers. Each link worker is attached to a specific primary care network, apart from our floating link worker who covers all the PCNs when people are off sick or on holiday or demand is greater. Each PCN has a whole-time equivalent link worker attached to them. What about the process? How does it work when you refer people to us? When we receive your referral, the first thing we do is we will make telephone contact with the person. We will then either arrange to have a longer telephone conversation, or we will meet with them face to face if that's possible and if it's needed. We will then have an in-depth conversation with them about their lives and the areas they would like to have some support in. We will explore and identify their interests and support needs and any barriers to them accessing services. We will then research what is available in the area, discuss the options with them, and link them in with these services. We always provide feedback to the referrer when the work is complete. The length of time spent on each person depends on the complexity of their situation and needs, but people can be re-referred at any time, either for the same issue or for different issues. So how do you refer? There are two ways of referring into the service. Health professionals who have access to EMIS can refer via this system to community services. Those who don't have access to EMIS can complete our electronic referral form. All referrals are sent to the Care Coordination Centre at Milford Hospital, where they're triaged and then sent on to the team leader, who will then allocate them to the link worker who covers the person's GP practice. We aim to contact the person within 7 days of receiving the referral, depending on the volume of referrals we have at the time. We provide all referrals with feedback, which is sent to the Care Coordination Centre, who either put a note on EMIS or send the feedback form to the referrer. I'd now like to tell you about a few people that we've seen and the ways in which we've helped them. So Colin is a young man in his 30s who's married with 2 children with special needs, and he's the carer for his wife who has serious long-term health conditions. Colin was referred to us by his GP because he was feeling overwhelmed and anxious, and he was aware that he was finding it difficult to go out. We made telephone contact with Colin, and then we did a home visit, as it was difficult for him to take time to meet us locally because of his caring responsibilities. We had a long conversation with him in which he told us that he was finding it difficult to take any time out from caring duties, and as a result was feeling more and more stressed. We helped Colin identify activities he'd previously been interested in, such as bowling, computer gaming, and visiting the library. Colin felt he needed some extra help to make the first steps out of the house. We found a local bowling group and some gaming groups and referred Colin to a local befriending service who matched him with a volunteer who could go with him to the library to help him build up his confidence. We also referred him to a carers support group and a support group for parents with children with special needs. Colin said that this support enabled him to build in time out for himself, which raised his self-esteem and made him better able to cope with his caring responsibilities. The next person I'd like to talk to you about is Julie. Julie was referred to us by her GP. She was in her 40s and had had a recent diagnosis of multiple sclerosis. This had meant she'd had to give up her full-time job teaching IT, and she was struggling to adjust to these changes in her life. We visited Julie at home, and she spoke about the emotional and practical impact of having to give up work. She also said that she would like to do some voluntary work teaching IT as a way of keeping a link with her former role, but in a way that she could manage. We discussed support for Julie to process the changes and losses she had recently experienced. And with her consent, we signposted her to some local counsellors who provided online and telephone counselling, which would be easier for her to access. We also identified some volunteering opportunities at a drop-in IT class in local sheltered housing and a local secondary school who were very keen to have her come in once a week. Julie said that she felt better for having support with her feelings of loss and also being able to use her previous work skills in a volunteer setting. Our final case study is Alice. Alice is 87 years old and lives alone. She's partially sighted and her anxiety has greatly increased during COVID. Alice is feeling lonely and socially isolated. She's not online, but has said she would like to get out with someone supporting her. Alice lives in Waverley, which is not well served with befriending services, so we have struggled to find support for her. We are now delighted to be able to refer her and the many other clients we have with similar needs to the Reconnection service. I'll now hand over to Tara to tell you about this new and much needed service.
Thank you, Nicola. Hi, I'm Tara from Independent Age, and I'm going to talk about our Reconnection service and how we work alongside social prescribing in Guildford and Waverley. Many of you will be familiar with Guildford and Waverley's large and growing older population, where the number of people aged over 75 is set to increase by 21% in the next 5 years. We estimate there are around 15,000 older people in Guildford and Waverley who are lonely, and this number is expected to increase as the local population ages. Loneliness and social isolation is not purely an issue for an individual's sense of happiness and quality of life, but has a real known impact on health and well-being. It has been compared to be as bad for one's health as smoking 15 cigarettes a day, as well as increasing a person's risk of cognitive decline and dementia, heart disease, stroke, and depression. Now, while living alone is not the same as loneliness, they often go hand in hand, and we know there's around 15,000 older people living alone in Guildford and Waverley today. Research published by the Health Foundation found that older people who live alone were 50% more likely to attend A&E. They were also more likely to visit their GP, have multiple long-term conditions, and have a mental health condition. Some of us have had a new taste of loneliness and isolation during COVID, but for many, this has been their reality for a long time. At Reconnections, we support people to rediscover their love of life, increase their social connections, and improve their well-being. We believe the best way to address social disconnection is through meaningful, sustained local engagement that doesn't just build companionship, it builds community. Reconnections is personalised to each individual, but there are some common features of the service journey. Firstly, we have an open referral process where anyone can refer themselves or someone else to the service if they are over the age of 65, live in Guildford and Waverley, and self-report as lonely. As professionals, you would refer into the service via the social prescribing team, and the general public can come straight through our front door. Everyone starts off with a personalised plan where we look at what they want to achieve and how they want to achieve it, and we use the 5 ways to wellbeing to consider a broad approach. We work with people for an average of 6 months, and we're very hands-on, providing both practical and emotional support. This might involve behavioural change and perhaps changing their attitudes towards ageing and what they can achieve. Everyone is supported by one of our trained caseworkers, and many will also be matched to a volunteer. We can't do what we do in isolation at all, and we work with others across the community to build that network of support around the individuals we work with, whilst engaging with whatever activities, interests, and new experiences they want to take part in. Ultimately, it's about building their independence, them not needing us at the end of the day, and looking forward to a future where they have new friends and support networks around them. And that in turn helps improve their wider health and well-being. As I said, no 2 journeys are the same, but I wanted to share an example of someone Reconnections has supported. So here's Pollys story. Polly was housebound when she was first referred to Reconnections. She was in a lot of pain with poor hip function and was struggling to manage her weight and diabetes. She had stopped engaging socially since her husband died and had become withdrawn and depressed. Her conversation tended to focus on her health challenges and the barriers they presented. She was often tearful and lacked confidence and motivation. Her days were spent in the same chair at home. After being introduced to the service, Polly was assigned to a caseworker who visited and helped her see beyond her current challenges. Together, they made a plan to work towards a happier existence. Polly was matched to a volunteer, Rosanna, who visited and called at first, then later helped her to get out of the house and attend external activities. As she began to move more and eat a healthier diet, her mental and physical health improved. Having Rosanna to accompany her to activities and social settings gave her renewed confidence, and her family began to see the old Polly coming back. Over time, she started attending a choir and local exercise classes independently and volunteering at a community cafe. 18 months on, she reported that she was no longer depressed, was managing her weight and her diabetes, and was now regularly out of the house and loving life. We are restricted in some of the activities we can do during COVID, but the team have continued to think creatively for different ways people can connect using our version of the 5 ways to wellbeing: get active, get mindful, get social, get helpful, and get learning. Some examples include our Couch to Community Step Challenge, our Meet Your Match postcards, and our tech tasters that help people to connect and increase their independence online. Hopefully, we have persuaded you on how social prescribing and reconnections can support some of the patients and residents you work with, and that you will be thinking of some people who might benefit. You can refer to us via EMIS or the Community Coordination Centre. When we receive a referral, the Reconnections and social prescribing teams will discuss who is better placed to support someone, or whether we might work alongside each other for a time to make sure individuals' holistic needs are being addressed and supported. Thank you for listening. Please reach out to the team for more details and do follow us on social media.